The Philippine Nurses Association of Nevada now brings you Filipinars, news and features about the Filipino-American nursing community and beyond. And now, here's your host, Doris Bauer.
Well, hello, Filipinars listeners and followers. Thank you for joining us today again at Filipinars. We do appreciate your continued support of our program. And as you know, Filipinars is a public service project of the PNANV, or the Philippine Nurses Association of Nevada, in collaboration with PHLV Radio. So thank you for joining. Well, there is a lot going on in our nursing community here in Nevada and nationwide as well. There are 3 major nursing challenges that are still ongoing. One challenge is still the emotional toll that the COVID pandemic has brought. The second is nurses dealing with workplace hazards. And third, but not least, is the nursing shortage. So many organizations are doing what they can to help alleviate this crisis. And that is the topic of our discussion in our podcast today. So we will be looking at one of the solutions that would help this nursing shortage. But before we get to our very special guest today, we would like to give you an update of a potential solution to the nursing shortage, which is the initiative for passing an NLC, or the Nurse Licensure Compact for Nevada. So the Nevada Assembly Committee on Commerce and Labor, supported by the Nevada State Board of Nursing, has sponsored AB 108, which enacts the Nursing Compact Licensure for Nevada. The PNANV and many nurses went to Carson City for Nurses Day at the legislature to hear about this bill. And finally, we have a hearing date for this bill. It's going to be on April 9th, 2023. So we are asking you, our nurses, if you can make that trek to Carson City or join via Zoom for this historic day, please do so. And also, let us remind our listeners and followers why supporting the NLC is very crucial. So let us hear from these nurses.
Hello, my name is Lisa Pacheco. I'm here because I'm in support of Assembly Bill 108, the Nurse Licensure Compact. I'm a registered nurse in Nevada with over 30 years of experience from bedside to boardroom. I'm a founding member and the current president of the Nevada Hispanic Nurses Association, and the treasurer for the Nevada Action Coalition for the Future of Nursing. Both groups not only advocate for and support nursing, we're ultimately advocating for the health of our community. Nurse Journal reported that Nevada ranks 49th with 9 nurses per 100,000 residents. Number 1 was Wyoming with twice as many at 19 per 100,000 residents. Nurses are counted in many ways: active licenses, number of jobs, number per capita, number by type of nurse, etc. But no matter how you count it, we simply need more bedside nurses. More nurses will lead to safer staffing and better patient outcomes. As nurses continue to leave the Nevada workforce faster than they can be replenished, this negatively impacts access to quality care and leads to poor health outcomes for Nevadans. The Nurse Licensure Compact began in 2000, giving nurses an advantage by permitting them to cross-border practice, relieving nurses of the burden and cost of obtaining licensure in multiple states. Nurses in states participating in the compact can practice in a multi-state license that allows them to practice physically, telephonically, or electronically in their home state and other compact states. Enacting the Nurse Licensure Compact in Nevada would reduce the barriers that impact cross-border nursing practice for registered nurses. Currently, there are 37 states that are participating in the compact. The Nurse Compact is similar to a driver's license. It is issued in the primary state of residence. Licensees are required to adhere to state law. Privileges can be revoked if the law is violated. And if the nurse's primary residence changes, the nurse must obtain licensure in their new home state. The Nurse Licensure Compact has many positive aspects for nurses and Nevadans at large. The compact gives a nurse that chooses to participate the ability to practice in multiple states with one license. The benefits of this are remarkable for bringing nurses to Nevada and providing smooth practice transitions for military families with nurses. One of the solutions for increasing access to rural Nevadans is telehealth. The Nurse Compact would allow nurses from other states to supplement our nursing workforce telephonically and electronically through telehealth, increasing the access to care in rural Nevada. The same supplementation would be accessible during a disaster as well. We saw that in the wake of October 1st in Las Vegas during the shooting. There were many practitioners that wanted to join in efforts immediately, yet we could not avail ourselves of this help in the immediate moment of the need. The COVID pandemic allowed for many nurses to come to Nevada to practice under the emergency declaration. We should not need or wait to be in a situation where an emergency declaration is needed to get rapid help for our citizens. The Nurse Licensure Compact would allow for Nevada to work on legislative partners and would encourage information, data, and idea sharing with other compact states. As with any change in practice, we must look for areas of concern. The compact has few issues that are concerning, and those concerns are minor. The most important concern is to address the potential loss of income for the Nevada State Board of Nursing and the possibility of raising the cost of nurse licensure in Nevada. The Nevada State Board of Nursing summed this up in their response to the Budget Office via fiscal note dated February 13, 2023. Their summary stated, the Board of Nursing believes that any potential fiscal impact would be absorbed by the board's current budget and does not anticipate any increase in licensing fees would be necessary at this time. Nurses were surveyed in 2022 by Nevada State Board of Nursing and the National Council of State Boards of Nursing. An overwhelming 92% were in favor of the Nurse Licensure Compact. The concerns of the nurses included concern for raising the fees for licensure and the quality of nurse that may come from out of state on the compact. The Nevada State Board of Nursing addressed the fee concern, stating they do not anticipate an increased cost for licensure for Nevada nurses. The concern of the quality of nurse is ever existing for all of us. The nurses in the Nurse Licensure Compact are subject to criminal background checks and additional standardized licensure requirements that will ensure the nurses residing out of state are no different quality than if they resided physically in Nevada. The Nurse Licensure Compact will increase the number of nurses available to Nevadans for care, as well as offer opportunities to Nevada nurses to work across state lines without leaving home. As an advocate for improving the quality of care Nevadans receive, I am in support of AB 108, and I encourage you to be as well. Have a good day.
Hi, my name is Angel Brock. I am a nurse practitioner as well as the president of Southern Nevada Black Nurses Association. I am making this video in support of Nevada becoming a licensure compact state. There are several pros to this. One is fiscally wise. It decreases the burden on Nevada State Board of Nursing to issue licensures to nurses, thus cutting down on staff, as well as the burden of monitoring nurses that are coming from out of state. It also makes it easier to develop a database when it comes down to disciplinary action, where the home state will be the disciplinary state. However, it makes it easier to track those nurses or non-nurses. The other reasons are educational. There are so many skill sets that sometimes we don't always get here in the state of Nevada. It will expand our knowledge and put us on a global stage as far as the profession. It also just makes sense. It makes it easier to promote this great state, but it also makes it easier to get traveling nurses to come whenever we're suffering a shortage. So, I am making this video in support of Nevada becoming a compact state because it just makes sense.
Well, thank you very much for your opinion on this matter, ladies. So the Philippine NARS goal is to disseminate information to cover both sides of an issue. And we have heard many opinions for those who are in favor of the NLC. And we are still inviting those who are opposing or who have opposing views to come to our program. And, we would like to hear from you. So if you want to come to the program and put your views out there on why you oppose the NLC, we welcome you. Just call PHLV Radio if you want your opinion heard. Okay, so today we have two very special guests who are very well known in our community, and I may dare say that they are actually pillars of our community. So they are here to talk about an innovative solution to our current nursing shortage. The program is called Healthcare Professionals Bridge Program. So please, let's welcome Mr. Harry Singh, the founder and CEO of HR Global Consulting, and our very own, PNANV's very own, Dr. Jay Tan, who is an assistant professor at UNLV School of Nursing. Welcome, gentlemen.
Thank you.
Thank you, Doris.
Good. I am so glad that you guys are here.
I would love to share good news that Dr. Tan has become an associate professor now of the UNLV School of Nursing. Congratulations, Doc.
Thank you so much.
He has so many other things going on with him, and he is, also a certified advanced nurse practitioner in several fields of specialization, especially geriatric and psychiatry.
Psychiatry.
Yeah. Okay. Do you have anything else to add to that, Dr. Tan?
His accolades is never ending. His resume is gone through. Because,
Well, you're not to be, skipped also, Mr. Singh, because Mr. Singh not only is the CEO of HR Global Consulting, he is involved in many healthcare organizations or initiatives like the Nevada Professionals Network, the AAG, which is the Asian American group. He is now the president of Autism Cares, the president and CEO. I did not know that until today. And he's also involved with the president and CEO also of the Nevada Community Health Center. He is with the Las Vegas, India Chamber of Commerce. And you are a chief advisory board member of the Henderson Police Department.
Yes, please.
And you're all over the place. And he is the chairman of the Diversity Council for the Nevada Donors Network.
Yes, please.
Okay. Do you have anything to add to that?
There are a couple of things which is left out. My major principle is to serve the community, whatever the capacity I have. All these presidencies are my group of companies. I own around 6 companies here, and besides my exports from India to your beautiful country, Philippines.
Yes.
We are doing a lot of services from India to Philippines by supplying raw materials from India.
Wow.
However, my commitment towards the community outreach and the helping the community in need of a healthcare initiatives is a prime focus in the United States. And I'm trying to serve the community in my best capacity along with my staff and teams and members of the community altogether.
Very good, very good. And Dr. Tan is busy as well, so trying to be involved.
Harry has been very helpful to the community too. So.
Yes. Okay, so to set the tone for our discussion today, the first question is for you, Jay, if I may call you Jay.
Yeah.
As a past president of the Nevada State Board of Nursing, and with your active participation with the National Council of State Board of Nursing, can you give us a synopsis about the nursing shortage in the U.S. and in Nevada?
Very well so. Well, the nursing shortage in the U.S. and it trickles down in Nevada has been a very long phenomena that is hunting the healthcare. To give you a really good bird's eye view, the U.S. alone was projected to need at least 1 million nurses by 2030.
Yeah.
And
Wow.
that's especially after the pandemic.
Yeah.
It was, so it is very. And then looking at the Nevada picture, there are 47,000 nurses in Nevada, but it is projected that within 2030, we need about 25 to 33,000 nurses
Wow.
here in Nevada.
Correct.
Well, let's look at the ratio here. The U.S. An average is 8 to 1,000, 8 nurses per 1,000 population. That's the average. There is no standard. That's all way
Wow.
low. Why? Because if you look at the world, the highest ratio of nurses to population is Switzerland. They have about 18 to 1,000. The U.S. stands an average in 8. Nevada
Wow.
is only 7.1
Correct.
nurses per 1,000 population. That's very challenging, Doris.
That
so that's
is.
this discussion is very timely, and thank you for building this one up, because
Absolutely.
I want to communicate that need, that gap
Yes.
that we're looking at.
And for those people who really don't believe that there is a nursing shortage, there is a nursing shortage, ladies and gentlemen. So if you're probably living under a rock if you don't realize that, right?
Yeah. Basically, I mean, you have to think about why is that so very, very quickly, because we have an aging population
Correct.
who is having some mental health. I mean, so not only mental health, physical health as well. And not only that, the nurses we have who's taking care of this aging population are aging.
Correct.
An
correct.
average of mid-50s to 60s,
Correct,
and
that
they're
is right.
retirables.
Correct.
So looking
Yes.
at that, that's where the 1 million need would
Yes.
happen.
Correct. Correct. Well, thank you for that insight, Jay. So, Harry, can you tell us a little bit about your company, HR Global Consulting, and what is your mission?
The company was created about 4 years ago, and with a simple thought that we will be like to work with the industries all together for the success as champions. And we are trying to find out the gaps in the spaces where the need is, and we started working towards taking an initiative, being the bold initiative to become an extraordinaries.
Okay.
So we become that group of people from the industry who's working with me as my colleagues to look into a space where we think it is a bold, and let's take it in our custodians, reshape it, and create something which is extraordinary. And that's the program which we created recent past.
So you're looking at the human resources factor?
Everything possible.
Everything possible.
Start from electronics zero to a human resources, everything is possible. We look forward to gather intellectuality from different sources, grab it together, and as an example, right sitting next to me is Dr. Tan, who is the first one who guided me how do we move forward in this initiative, which I delivered it to all the higher education department of Nevada, who
Very good.
accepted it, and the first one which has come our way is the College of Southern Nevada.
Yeah. Well,
Yep.
we'll talk about that. So,
Yes, ma'am.
you and your company are very much involved in the issues of the shortage of medical and healthcare professionals, right? How do you help your clients with this problem?
See, as I said, I got a wonderful team with me. Our main emphasis is to go global and educate the community leaders over there, directly,
Okay.
indirectly involved into healthcare, the people who carries an influence. We try to identify the main cause. What is the main cause, where the gap is, and how do we fit into it? And education is one aspect which we cannot ignore. It has to be fundamentally not only academics, but educating the resources and sources also plays a major role. And we
Okay.
try to improvise that, and we move forward with that, and we had wonderful results for making the workforce ready for this aspect.
For that aspect.
Yes.
Okay, so what can you give us your insight? Can you give the listeners an insight, your insight on this nursing shortage?
My insight is status quo, and as the statistics, as Dr. Tan has already touched upon it, that as far as America's Nurses Association is concerned, as he rightly said, there's an aging population is there.
Right.
Then we have got an aging nursing population. But the question goes is post-pandemic, if we look into an aspect of an aging nursing population, do they have a capacity to handle the patients as we have a acute shortage.
Yeah.
If we calculate, say, of the 1,000 people fall sick altogether, do we have 7 nurses only?
Yeah.
Yeah.
So
yeah.
that's a hit point. And then we blame our physicians, our doctors, and the nurses
Correct.
because the patient says, I'm waiting time is little extra in ER to be attended to.
Correct.
But there is another problem which need to be addressed.
Yes.
Then we have been saying it. Actually, in last 3 years, the nurses are completely burned out.
Yep.
And you can
Absolutely.
see it. The people have changed their path. They are no more nurses. They changed their profession as well. And even if you go down to any industry, not in the United States, but globally, my research team says it, global impact is the workforce is not available in every sphere, not
Yeah.
only nurses.
Yeah.
But where are they gone? The big
Yeah.
question. They are burnt out.
Of course, yeah.
They are not ready to take any extra challenges. And when it comes to a domestic market of producing these nurses are concerned, comparative to demand is concerned, it's not matching. That's what our graph is going on a shortage of very high.
Yeah.
By 2030 is just 7 years ago. 7 years to go.
Yes.
And within
Yes.
7 years,
Yeah.
where are we dragging to? We don't know.
And yeah, the shortage is really, and feel free to
Yeah.
chime in,
Yeah.
Jay. The shortage
There are two
causes,
impacts I would like
yeah.
to touch on.
Sure,
When
go
we
ahead.
talk about empowerment, we talk about a lot of speaking points on the women empowerment. I'm not talking about the women as an individual. They need to be empowered. But when you have a specific goal, objective, and a professional, that need to be empowered.
Right.
Do we have a system of empowering our nurses? Do we use that latest technology to educate them, to release them from a pressure tactics? Their performance level will go up.
Yes, yes.
Then you go as in a staffing ratio, as he already touched. We have a 7.1 nurse against 1,000 population.
Yeah.
I pray to the God that we do not see any kind of a issues, pandemic, or kind of an episode of a Mandalay Bay, which has happened in past, where 500 people
Yes,
who are fallen
yes.
sick in the
Yeah.
hospitals.
Correct.
So these are impact which we need to address, and this is what HR Global Consulting and the team of consultants and the experts like Dr. Tan and more on are with me to find these solutions, and we are ready with it now.
Yeah, that's really good because the shortage not only, it's like a domino effect that leads to other types of issues that we just need to be able to understand and then find solutions. And I'm so glad that you two are doing that actually. So let's say, okay, so your company has initiated the Healthcare Professionals Bridge Program.
Yes.
Correct, as part of this solution. So can you tell us a little bit about it and how does it work and how will it help
yes,
the nursing shortage?
I'll take a minute, go back again on Dr. Tan's statement of a shortage of a workforce. We are not able to produce the domestic population converted to the requirement percentage is concerned. Now,
Correct.
what is the solution? Do we have a people existing who's wanting to come back to the job? No.
Yeah.
People have already gone.
Right.
They move forward. But what is happening is, as we are not able to produce in time, this competitive world, we got to have an import coming in. Meaning the workforce has to come from other countries.
Correct.
Now the big question comes in. Are they matching American healthcare system requirements is concerned or not? They don't.
No.
So actual problem which we did a research when we started about 8 to 10 months ago in 2022 is to do and finding it out what are the issues and the problems which these foreign nurses are facing it. So I've been hearing it out, a lot of stories from nurses existing, and this is a lot of agencies has visited their fellow countries, give them something beautiful tasks and everything, and they had to wait for 2 to 3 years.
Yeah.
But still, they are not able to match the requirement of United States. And so it means their valuable time of 3 years waiting under anxiety, under stress, and not able to do anything else but to wait.
Correct.
So therefore, when Dr. Tan, myself, was fortunate enough to have a couple of times with him, we explored some possibilities that why can't we bring these foreign nurses to come to US?
And help them.
We will train them here
Correct.
to reach to an American healthcare system, which an American Nursing Association or the Board of Licenses or the Board of Nursing is requiring them to be functional.
Yep.
Yes.
So that's the gap which we created. We had struggled a lot creating a curriculum. We struggled a lot to take intellectual inputs, and everything has been created for 6 months program to make them qualify to reach our level.
Very good, very good. So you're recruiting the nurses from foreign countries to come over here and work in the United States, but also taking care of what they would need in order to get the licenses and adapt. Okay, and adapt to, because it is a different culture. And I had that, when I came here, those years ago, it was very difficult because you're looking at different language, a different culture, right? And so you have to be able to kind of adapt. Even the test questions, that you have to undertake, or the exam that you have to undertake before you get your nursing license, is different because it's towards the culture of the United States,
so basically
right?
it's the assimilation and acculturation
correct.
is what really is important.
Not only
in
that, I'll touch upon it to our fellow listeners. See, even if we talk about only an NCLEX, NCLEX trend is also changing. It's just not like, for example, if an agency sitting in India or any other foreign country or in Philippines and trying to teach these nurses in their own fellow countries to get them educated on NCLEX and get examination filled up, are they equipped with the latest trend? That what is happening with the board, and then NCLEX board is putting into it, the new trends. So that misconception and the gap which the existing nurses who wanted to come to US and function and work is missing that concept. So that's what the gap which we filled up here.
That's fantastic. So it is really getting exciting because when I first heard about the program, I was like, well, how exactly is that going to work? So that's why you guys are here today. And so turning to you, Jay, so having been, you have been working with Harry here with the educational component of this Healthcare Professionals Bridge program. So specifically with the preparation for NCLEX. So for those who do not know what NCLEX is, can you please give us, what is it? What's the process?
Exactly. So NCLEX is the national examination for nurses to take any person graduating here in the U.S. or from different country. Their entry into the profession is to pass what we call as NCLEX, or National Council of Licensure Examination, given by the National Council of State Boards of Nursing, who actually make NCLEX and create the standard of safety. So being that standard of safety, NCLEX is an examination that any nurses or every nurses, a graduate nurse, has to take and pass in order to practice nursing here in the United States.
The United States, right.
So that's basically the whole gist of the NCLEX. And there's only one agency who oversees it, although it can be given in different places and licensed in different states, but is made, controlled, and evaluated by a body called National Council of State Boards of Nursing. That is a congregation of all state boards of nursing all over the U.S. And Canada also uses NCLEX.
Oh, and you are part of that,
and
right?
I'm part of that. I've been with NCLEX for 10 years, making the question, evaluating the question, and being a chair also of NCLEX since 2017.
Fantastic. Back in the day, those examinations can only be taken here in the United States. Is that still true, or you can take them?
It's been a while now that it's only taken here in the United States, because even way back in 99 to 2000, there are already NCLEX examination places outside the U.S. In fact, the Philippines has one in Makati. And I don't know if India has one, but Hong Kong has, and different other countries, because it's just a matter of testing center.
Correct, right.
It's still controlled by
Right.
NCSBN. So they could take anywhere in the world as long as it's an approved testing center, pass it, gain employment here if they are an internationally educated nurse.
Because back in the day also they brought the nurses here. They took the exam. Most of them didn't pass, and it was different segmentation at the time, and so you have to go back and retest. And so here you are. You were recruited as to become a nurse over here, and then you didn't pass the exam. So now you're demoted to some other kind of job, like I don't know.
Aid or
A nurse's aid, or
non-licensed, basically.
and some of them actually took the LPN exam and they were able to work. So that is tough. But so having the NCLEX exam prior to you gaining employment here is fantastic.
And I would like to bridge into what Harry has mentioned before, where this bridge program makes sense and is impactful, because not only acculturation and difference in culture, NCLEX itself evolved. And Harry mentioned it earlier. By April 1, 2023, NCLEX would change to a different format called New Generation NCLEX.
That's fantastic.
So
I don't
that
want to take it anymore.
And that's where the bridge program we're talking about, to get them ready to transition life and professional life.
Yeah, life, professional life, and acculturation is really
Add
important.
to his statement,
Yes.
Dr. Tan, like even if we have got 20 examination centers world across of NCLEX, are those trainers, the teachers who's making those nurses in Philippines, India, or anywhere, preparing them for NCLEX and appearing for examination, are they aware of that, the latest changes, the trend? They don't.
They don't. And this is where you all come.
This is
into
what
play,
the
right.
program
The
which
program.
we created along with his inputs and everybody's is saying it we will educate them the latest, and
Yes.
we will make them a competent workforce.
And be
whether they want to
prepared.
go back and work in their own country, they are welcome to go. But there are a lot of opportunities gets open, but the employer is also looking at them. Oh, this nurse is qualified to work here.
Oh, that's
So
that's
that
great.
that gap of waiting time is gone.
It's gone. Oh, okay. So this is really a very crucial component of that bridge program. And so besides the NCLEX preparation, do you have any other educational components of the bridge program?
Yes, it is. It has got a component of American healthcare initiatives. All the rules and regulations will be a part of it. As a nurse, she must understand how is she working on a floor, as well as in administrative department as well,
Sure.
those educational qualification. Then English proficiency is very important. It's just not English. It's just not TOEFL. It is an English proficiency because there is a fun. Take me on a lighter note. Usually the people have been hearing this joke that when there is a physician calls, the nurse is found in a bathroom. Because they ignore the call. Because the physician talks very fast, and sometimes when the English listening skills and noting the skills is missing in component,
Yes.
there is a problem.
Yeah.
So
there is.
that's a bridge program, and it calls as a bridge. We are connecting the gaps and making a person to sail through easy.
Okay, yeah.
And then to add on what Harry has mentioned also is that I did research and published it internationally in 2013 about acculturation of internationally educated nurses. And with that, I used the technique, and we talk about this with Harry, of training these nurses and complementing with simulation technology.
Correct.
Yes.
Human patient simulation,
That's
wherein we take care of simulator, which are robot, and if they have, if along the way they commit error, they're not killing somebody.
They're not
it's
killing
a
somebody,
very safe
right.
environment, but a very good environment to build up skills, confidence especially.
Correct.
The confidence and competence that a foreign nurse should do in order to be successful. Because we're not only for them earning money, we want them to be successful.
Correct.
Like you, Doris, you became the president of the Nevada State Board of Nursing. You started that. I was a CNA. I started that story,
Yeah.
and then I became the
Yeah.
president of the Nevada State Board of Nursing. You know,
Yeah,
so
yeah.
so it's a life story.
And Dr. Tan is allowing me to write many stories now.
Yeah, that's true. And I'm into
Yeah.
my second research with that also, with my PhD that I'm
Correct.
building up, and which is the effect and the result of that. So that's why I'm
that.
complimenting him.
In my communication, I took a couple of the lighter modes, and I see Dr. Tan is doing his second PhD over a slice of pizza. Many computers.
That's
a
Jay
slice-
for you.
I catch you there.
Yeah. So how? Where are the trainers coming from? Is this
It's a local trainers from the state
local
of Nevada.
trainers? Okay. All right.
We have got a faculty, including Dr. Tan's volunteer time will be asked for it, requested, even though the faculty from the nursing school from College of Southern Nevada will be available. Some component will be provided from other colleges, and the experts from the different industries will be a participant. Because since involvement of a college which is a state college, so they have all the competency available to educate these candidates. However,
Yeah.
special education related to the NCLEX is concerned, yes, Dr. Tan's volunteer time will be requested so that he can guide the faculty members how to proceed on to it, how to educate them.
How to
so
educate
that
them.
the candidates are, first, they will feel competent, comfortable, and they can be ready to deliver.
And they will not be shaking in their boots on their
Well,
first day of
absolutely.
school,
Yeah, and it bec-
first day of work,
And
right?
it becomes a passion, Doris,
Yes.
because aside from my background in policy and public safety, I'm also in the University of Nevada, Las Vegas,
Right.
which is academia. So how could I use that background of academic into public safety? So
Correct.
that's basically where we bridge the gap to.
Fantastic. So, okay, so you have piloted this program back in 2022 in CSN.
It was started in 2022,
Okay.
but now the first batch will be arriving anytime next month.
That's what I said. You
And
piloted this with the College of Southern Nevada. Right.
Yes.
How's that going now?
Pretty strong, wonderful. All academics are ready. The curriculums are absolutely ready. Their visa documents has been processed. Now the documents which is coming my way will be dispatched to each candidate by another 10 days time.
Wow.
And they will apply for their visas. The first batch is expected to be here by May mid, and we are good to go.
That is fantastic.
Yes, ma'am.
That's really great. That's really great. So, has any other colleges joined?
The other institutions is on a talk already. I would say that with the pride that the UNLV Dean of Nursing is already in communication with me. So we want looking at the market potential, that how many numbers we can absorb. Even though the
Okay.
CSN has already given us a go-ahead with at least 3 or 4 cohorts a year of approximately 40 or 60 candidates in each cohort. But
Okay.
keeping in mind the inflow and the demand is concerned, our other offices from across the globe is already working. So I'm getting a feed up that, like, for example, India is talking about 400 candidates enlisted. So they are waiting for me to go and present and get the process started. So similarly, our operations is in Philippines, India, Middle East, as well as in African countries is going on. And we are focusing into Hispanic population right now to touch base on Mexican market as well, because Nevada is known as minority majority
Of course.
state.
Right.
So we have to capture that linguistic issues as well. So if we get to the bilingual, it will be an added advantage. So we are focusing on to various part of the world, and the numbers are getting in. Institutions are coming forward. CSN is a pilot, so we are going ahead, and we will repeat this with the UNLV as well as in Nevada State College as well in future, so that we can match the numbers.
I am so excited because I had a misconception when you presented, at our Christmas party. I said, well, how is this going to work? I didn't realize that you were already recruiting for the actually trained nurses in the other countries.
Yes, ma'am.
You're not going to train them here, but they're already trained as nurses. You're just recruiting them, kind of like.
In our system is as we said in earlier, that the waiting time is very minimum for nurses not to. I was there in Makati City, which is a popular city, and I stayed there for about 6 nights. 3 days we did a presentation, morning and evening. We had 400 candidates.
Wow.
I shortlisted 120, out of which 88 is flying in one jet.
Oh my God.
So this is the ratio we work, because my system is very clear in our organization is being very transparent. Be within the lines of discipline and code of conduct and ethical work systems.
Absolutely.
And since we have a wonderful faculty associated and the masters of the subject are there with us, so we are all geared up all together. Now it is a time to deliver.
I would love to see that when they land over here. Just give them a welcome,
Of
and
course.
that we got to do it. We got to do that. We got to do that. And you actually answered my next question, which is where foreign countries? From what foreign countries are you looking into? So
We are in
Philippines.
Africa. We are focusing in Kenya, Nigeria, Ethiopia, and Ghana. That's a major impact because we have a population existing here. Philippines is a major focus because
Yeah.
we have almost 300,000 Filipinos living
Filipinos living here, right?
Las Vegas only. Forget about the upper north.
Yeah.
We have then not only nursing, we have almost 400 group homes also. We are not forgetting that. We are running short of almost 700 caregivers too, which is
Yeah.
health aid professionals.
So medical
So we are bringing along with the
professionals, right?
nurses,
Right.
health aid professionals is also on the queue to come in.
Okay. So have any other organizations joined your cause? Like I know the PNANV is also supporting
They are the
your
first ones.
your bridge program, and I'm happy to say that I'll do what I can to help you out and get those nurses here and get them trained and acclimated. So
As we rightly said, it's a pilot program to see all the plus and minuses of the first batch. So it's always there. Then when we voice it out with the Filipino Nurses Association of Nevada, they were the first one to welcome us. And to be proudly saying it, I have not advertised anything. Zero advertisement. It's you all who spoke to your fellow countrymen over there.
Word of
And
mouth.
which, that's
Yeah.
the only thing which I earned.
Well, we're hoping that this broadcast, which is also seen in other countries,
Yep.
we're hoping that you all share this broadcast, regarding this healthcare professionals bridge program. So
Absolutely.
that's good. That's good. Let's see. So, what else can you say about the bridge program? Do you have any?
It's basically training them to be a functional nurse and a successful one. I mean, the other side of the coin to Doris is that the concept of brain drain, from the Philippines, and then we took them out here in the U.S. because we need it. But this bridge program, Harry, actually stimulated me to create my next research, which I called actually "Brain Drain is Brain Gain." So we might be telling
I'll be charging a
draining,
fee.
Pretty.
but we're training them here to build
Yeah.
up their brains to be a part to the safety of the American and the world
And the
population.
That's what I'm saying,
So-
Doc. I'll
Yeah.
charge a fee from you. That I instigated you to do your second PhD.
So that's actually what I'm
That's
working
the
on
need.
is the brain drain and brain gain, the live experiences of internationally educated nurses, assimilation to the Western
Yes.
world.
Yes,
Correct.
assimilation, acculturation. I'm pretty big on that word, acculturation.
Yeah.
Because you do have to. You're going to a foreign country. You're going to a different culture. You have to be able to somehow assimilate, into the culture, but still keeping your background, your what do you call it, the things that you learned. As
It's your contribution,
correct.
global contribution and impact.
Yep.
Yeah, right. Okay, well, this is very, very interesting. I'm really, really excited about this program, and I'd be happy to share it to anything that anybody that will listen. So that's why I'm here. Anyway, so two questions to both of you. How can some of the nursing associations help with support the bridge program?
I would say that on my website, which is there on a flyer, you can ask any questions onto it. My personal email ID has been given in case if anybody has questions to ask. My only request is to communicate with your fellow people who needs to have, you come to a platform which is an internationally acclaimed, make them equipped, let them be a workforce on a global front. And we have got a wonderful educationists which is there, which tremendous experience of their nursing career as well as being humans. They are ready to deliver and to make this workforce worthwhile, which because they have to be recognized globally that they have done something beautiful in life. It's just not taking care of the patients. It's just beyond that also. There are a lot of things which a nurse can do.
Yes, yes.
So because in the community, as I said, we are in community. So the community need a lot of nurses as a volunteer to come out and educate the community before even they fall sick.
Yeah, and
Minor things need to be taught.
Correct. And I do agree with you. There's an adage that says, well, it's not an adage, but, if you want something done, just ask a nurse.
Absolutely. Don't run to the bathroom.
So, Jay, do you have anything to add to that?
Yeah, just to add a little bit with that one. Professional nursing organizations such as PNA, can very well help the acculturation system by welcoming them, number one, and not only that, providing mentorship. And I think
Right.
PNA is a very good organization because there is a mentorship.
We do have a mentorship program.
And the PNA, and it even
Right.
started by the president now,
Correct.
Flora Saison. She did that and initiated that out of her doctoral paper.
Right.
So that's
Right.
why I think that is a very valid program that is going to support and thread through in acculturation and assimilation of these foreign educated nurses.
That was the reason that we cultural competency is a component of this course.
Yeah.
We do not
Fantastic.
want the foreign nurses to feel that she's exactly in a foreign land. Yes, they are.
Exactly.
But they should feel that where they are working in the same competency which others are.
So, like you mentioned a little earlier before the broadcast, let's get some of these nursing organizations together
Yes.
to, introduce the Bridge program, what the components are, and how what
And
they
make
can do
them
to help.
an active partner,
Absolutely.
a community partner.
Yes,
Absolutely.
correct,
Yeah.
correct.
With
So that's
this
basically
podcast, I request all the nursing associations of the state of Nevada to come forward.
Yeah.
Let's meet together. Let's talk about it, and we'll find the solution. It's nothing difficult to find, not to find a solution.
Yeah, it's very collaborative.
Absolutely.
Has
Very
to be that way.
collaborative, correct.
Yeah.
So, if y'all heard that, just give either PHLV a call or PNANV. Go to our website. We do have some things in there. And also go to HR Global Consulting website. We'll give you the emails in a few minutes. You can actually, if you're interested, you can actually email Harry at hrgcllc.com, or you can even copy Faith on it. Faith is one of the his assistants. So it's Faith at hrglc.
HRGC LLC.
I'm sorry, HR.
GCLLC.
GCLLC.com. Okay. Thank you. Okay, so finally, what is your message to the nursing community and to the public regarding this nursing shortage? Let's start with you, Harry.
I would certainly like to say a few words into it, that the single most important word which says is support each other. Come forward. Expand partnerships. Education is utmost important. Even though any other foreign world which we learn our skills in nursing, we have a lot more to learn from other countries too.
Exactly.
So that can only happen when we hold hands, we expand each other's, we enter into education, and we develop our skill sets. Come forward, and there's nothing difficult to not to achieve it. Nothing is impossible. Everything is possible. So my saying is, if you have any thought of thinking about it to go global, come forward. Take a step. We'll guide you.
Very
Well-
good, very good. Jay.
Well, for me too, I mean, especially addressing to nurses throughout the world in a global spectrum, is to first go where your heart leads you.
Yep.
Follow your passion.
Correct.
And if your passion leads you to come to the United States, we are here. We will guide you to your success. It is not a loss where you came from, but it is your gain for your life and the rest of the world.
Absolutely.
Absolutely. Wow. I am so glad you guys came to discuss this. Thank you very much, gentlemen. Mr. Harry Singh.
Thank you. Thank you very
and
much.
Dr. Jay Tan. Thank you
you,
so much
Doris.
for gracing our program today. You definitely are very, very inspiring and
Thank
a big
you.
help to the community. And I'm hoping, and we are, I know that this bridge program is going to work and at least be some kind of a solution for our shortage. So thank you
Yes,
again.
yes. Thank you.
Thank you
Thank
so
you very
much.
much for having us. Thank you.
Okay. Anyway, so to our listeners, if any of our listeners know of nurses who would be interested in the bridge program, or if you are a nurse abroad and are interested in the program, you can contact HR Global Consulting. You can email, again, here you go, Harry at hrgcllc.com or Faith at hrgcllc.com. And as a final thought, there is indeed a widespread of nursing shortage across the U.S. and, of course, in our own state of Nevada. The demand is increasing constantly. And like Jay had said in the beginning of the podcast, and also this is research from the labor departments of Nevada and the states, that more than half of our current working nurses are now over the age of 50. So we welcome any ideas to alleviate this shortage. We thank organizations like HR Global Consulting and the brilliant minds of Mr. Harry Singh and Dr. Jay Tan to come up with innovative solutions. Thank you again for joining us today. Thank you very much for giving us the privilege of your time. This is Doris Bauer, your Philippine NARS host, signing off for now.
The Philippine Nurses Association of Nevada has just brought you Philippine NARS, news and features about the Filipino American nursing community and beyond.